we just want to share a few insights on how you can ease your pregnancy, how you can manage the challenges that come along through this pregnancy journey, and not just through the journey that you survive, but also after the delivery. A lot of things that you do right now, of course, helps you during the pregnancy journey and after the delivery, during for your recovery, and of course throughout the postpartum journey. Not to mention, whatever you do right now also helps the development of your baby, which is inside you. And of course, all of us, all the moms, would care more for our babies than us, right? So let's go ahead and let me first introduce all of you to our esteemed guest for the day, Dr. Akta Bajaj. She is a senior consultant at major hospital chains in Delhi, such as Cloud9 Group of Hospitals and Ujala Cygnus Group of Hospitals. She is an expert in gynecology and obstetrics. And she has over 26 years of experience, which is quite a lot. Not just that, she has been a recipient of multiple awards in her career. Some of them are National Healthcare Achiever in Gynecology 2015 and Best Doctor in Gynae Surgery at 7th MT India Healthcare Award 2017. So I would take this opportunity to invite Dr. Akta and help us with some of those insights that all of you are eagerly waiting for. Over to you, Dr. Akta.
Thank you, Parul. Thank you so much for kind words. And thanks to Tata 1mg for arranging this wonderful session and for giving me opportunity to talk to pregnant ladies. And as we all know, pregnancy is, I think, one of the most beautiful journey in a woman's lady. And but it brings a lot of challenges. A pregnant lady has a lot of fear, anxiety, as well as excitement. And a woman's body goes through a number of changes during pregnancy. So today I will talk about changes during pregnancy, mental changes, emotional changes, physical changes, about baby's growth, and do's and don'ts of pregnancy, and how she can have a healthy pregnancy and a healthy baby. Is this normal? Whenever I sit in my OPD and first time pregnant woman comes to me in her first pregnancy, the most frequent asked question is it normal? Because she has so many symptoms. Her body is going through so many changes. So she asks, is it normal? Is it normal to have nausea? Is it normal to have pain? Is it normal to have spotting? So I will take all the symptoms one by one, and I will let you know when it is alarming and when it is normal. First, I will talk about first trimester. First trimester is till 13 weeks of pregnancy. That is first 1/3 of pregnancy. And I think this is the most challenging period of pregnancy because woman has nausea, vomiting, she is confused. She doesn't, in first pregnancy, she doesn't know about these symptoms and she is confused. What is normal? What is not normal? Nausea with or without vomiting, which is called morning sickness as well. And I think 80 to 90% of ladies, pregnant ladies, feel nausea. And it is most common in first trimester and begins usually around 6 to 8 weeks. And it is high, very high at 10 to 12 weeks. And after the first trimester, it usually subsides. But some women may feel nausea throughout pregnancy, throughout 9 months. This is also normal. So you should not worry about it, but you should you must see that your hydration is maintained and you have proper nutrition. And if nausea vomiting is very severe, then you must take help of a professional. You should talk to your doctor so that she gives you medication so that your symptom is less. Next comes increased urination from higher blood volume. In pregnancy, blood volume increases and In pregnancy, blood volume increases, and a pregnant lady might feel increased frequency of urination. She has urge to pass urine again and again. It could be due to pregnant uterus might irritate bladder, and as volume is increased, so kidneys have to function little higher, and more volume of urine is created, which is passed on to the bladder, that is urine bag. Tender, swollen breast due to hormonal changes. Under the influence of hormones, in pregnancy, progesterone level increases, and the breast, they start preparing for newborn baby, and they become tender, swollen, and especially in the first trimester. And some ladies might feel milky discharge or transparent discharge from nipple. This is also very normal. And after a few weeks, this symptom also subsides. So she should not worry about it. She can take mild painkiller if it is troubling her, like paracetamol. Fatigue, sleepiness caused by soaring progesterone level. This is very, very common. प्रेग्नेंट लेडी कम्स एंड टेल, हम तो सारा दिन सोते ही रहते हैं, हमें बहुत नींद आती है, बहुत थकान होती है, बॉडी एक रहती है, मसल क्रैम्प्स होते हैं. दिस इज ऑल्सो नॉर्मल. सो यू शुड लिसन टू योर बॉडी. यू शुड टेक प्रॉपर रेस्ट, and sleeping more than as you used to sleep earlier, it is normal. Constipation, again, it is due to high level of progesterone. And in second trimester, as iron supplements are started, iron supplements also, they might cause constipation. And for constipation, she should take high fiber diet, and she should take lot of liquids, and exercise and physical activity should be maintained, because sedentary life, that also adds to constipation. Food cravings and aversion due to hormonal changes. And smell problem. She becomes more sensitive to smell, taste, etc. Pregnant lady, she might develop new taste, and she might have very strong food cravings. It is very normal. But I would like to add something here. She should not, she should listen to her thoughts, whatever she should do, she should eat what she likes, but she should also see that weight should be, in normal range, and average weight gain during pregnancy is 10 to 12 kg, and she should not eat junk food and sweet things, because if weight increases more than normal, that is 10 to 12 kg in 9 months pregnancy. If weight gain is more than that, so it might cause pregnancy associated complications like PIH, pregnancy induced hypertension, and gestational diabetes mellitus. So weight gain should be average, and it should be about 10 to 12 kg in 9 months. And one more thing, in the initial few weeks and in the first trimester, especially as nausea, vomiting is there, and she doesn't feel like eating, she might lose 1 to 1.5 kg weight in first trimester. This is also normal. Mood swings go through range of emotions like delight, anxiety, exhilaration, exhaustion. New baby brings emotional stress. Support is crucial. Emotional mood swings are very, very common. Pregnant lady is anxious. Will she be able to take care of her baby? Will her baby be normal? Lot of thoughts going through her minds. So her family, her partner, her friends, they must support her. Now I will talk about second trimester. Second trimester starts 13 weeks onwards. It is between 13 to 26 weeks. Growing belly and breast as uterus expands. In the first trimester, uterus lies in the pelvis. It starts coming in the abdomen and showing in the abdomen in second trimester only, 4th month onwards. Skin changes, that is again due to hormonal changes. Melasma, there is pigmentation on cheeks, and linea nigra, there is pigmentation in the abdomen, in the midline, and stretch marks are also common. Stretch marks are basically due to dryness, so she should apply moisturizers and creams which come for preventing stretch marks, and she must start 4th month onwards only. And she should not worry about it, because this pigmentation and stretch marks fade away after pregnancy. Hormone increase may cause stuffiness and nosebleeds. As in pregnancy, blood volume increases, so there is congestion in nasal mucosa, and nasal mucosa becomes more fragile, and she is common. She can feel stuffiness and nosebleeds. Dental issues again very common in pregnant ladies. Gums might become sensitive. Circulation changes may cause occasional dizziness, especially in second trimester. Blood pressure falls due to changes in the blood volumes and other hemodynamic changes. So she should take proper rest, proper diet, and hydration, which is very, very important. Leg cramps again common. Vaginal discharge, urinary tract infection are common. In pregnancy, immunity is comparatively less as compared to non-pregnant state. So a pregnant lady is more prone to infections like urinary tract infection and vaginal infection. But she should identify which vaginal discharge is normal. When vaginal discharge is transparent, non-foul smelling, no itching, it is normal, and it is not sign of infection. But if it leaves some stains, or it is foul smelling, or she has redness in her private parts, or she has itching in the private parts, it means there is infection, and she must talk to her doctor. And urinary tract infection in pregnancy, as it is frequency of urination is increased, but it could be due to UTI. So she has to identify there is no urinary tract infection. For that, we can take a very simple test, urine routine and microscopy. And usually we do in all pregnant ladies in the very first visit only. And due to urinary tract infection, she might have preterm labor. So to avoid that, she must be treated promptly for urinary tract infection. And if left untreated, infection might ascend to kidneys, and the infection might become severe. So it should be treated promptly. Emotional changes in second trimester. Fatigue is little reduced as compared to first trimester. Increased motivation for baby preparation, more prepared to ready oneself for parenthood. First trimester is little difficult. Body is adjusting to changes. By the end of first trimester, when she enters second trimester, she is already acclimatized, adjusted to the changes, and her symptoms also improves. Nausea improves, fatigue is less, and she is ready for newborn baby. Now I will talk about third trimester, physical changes. Third trimester, again, it becomes uneasy for a pregnant lady due to pressure, and baby's growth, it multiplies. And first trimester start after 26 weeks, you can say 27 to 40 weeks, because total 9-month pregnancy is 40 weeks duration. By the end of 26 weeks, baby is about 1 kg, 800 grams to 1 kg. And in just these 3 months, babies in normal pregnancy, baby's weight becomes triple. It might reach 3 kg. And average weight in India is about 2.5 to 3.5 kg. So you can say in third trimester, weight becomes almost 3 times. Backaches, pelvic area changes may cause discomfort. In pregnant lady, there are a lot of changes in body, and connective tissue become loose. And when it affects pelvic bone, lady might have pain in the lower abdomen, which is a usual complaint, but it is normal. And backache again due to pressure, because baby is growing, there is baby's weight is increasing, she might feel backache. And she should also take proper supplements like calcium, vitamin D, so her bone health is okay. And shortness of breath, as pregnant uterus is growing, it presses upon lungs, and which decreases lung capacity, and she might feel shortness of breath. For that, she can do yoga, and she should practice deep breathing. It will help. But shortness of breath could be due to some respiratory cause, respiratory disease, or some heart disease as well. So if symptoms are severe, she must talk to her doctor. Heartburn. Hormones relax stomach valve, leading to reflux. And in third trimester, pregnant uterus presses upon intestine, and under the effect of hormones, as I told, valve between esophagus, that is the food pipe, and stomach, it is relaxed, and acid might travel to esophagus, which gives her heartburn. And for that, she can take antacids, and she can take medicines like Eno, Gelusil, or if it is severe, she definitely needs to talk to her doctor and need medication for that. Another skin changes. Increased blood circulation causes vein issues like spider veins, varicose veins, and hemorrhoids. In pregnancy, many ladies develop hemorrhoids, and which might recover. She might recover after pregnancy. And baby's descent into pelvis puts pressure on bladder, leading to frequent urination. In first trimester, frequency of urination is increased, and in third trimester again, frequent urination is there. Again, we need to rule out urinary tract infection. Emotional changes in third trimester. Anticipation of childbirth can bring persistent fears about pain and coping. As the time of delivery is approaching, so many questions come to pregnant lady's mind, and she is anxious about delivery process, how much pain, how much time it will take, normal delivery, cesarean section, and after how long she will recover, will she be able to breastfeed her baby. So this period is again difficult, and her partner, family, friends, doctor, everybody should support a pregnant lady. Now we will talk about baby's development inside you, trimester wise. In the first trimester, baby size is about 1 inch long by the end of second month. Neural tube, which eventually becomes the baby's brain, and spinal cord closes during the first few weeks of pregnancy. I would like to say a few words about neural tube defects, where baby's skull bone and spinal cord backbone is not properly formed, and some neural tube defects like anencephaly, meningocele, meningomyelocele might develop. But if a pregnant lady takes folic acid during first trimester, these defects are 100% preventable. And any couple who is planning, any lady who is planning pregnancy, she should start folic acid 2 months prior to begin her pregnancy. Detectable heartbeat after 6 weeks, which can be seen on ultrasound. By the end of first trimester, the baby's major organs such as heart, brain, lung, liver, and kidneys have started forming. And by the end of first trimester, on 12 to 13 weeks, we do recommend a very special ultrasound, level 1 ultrasound, or we can say an NT scan and NBT scan, where we check for some important landmarks, nuchal translucency and nasal bone thickness. And on the same day, double marker, a blood test that must be done, because by doing this ultrasound, that is level 1 ultrasound, NT scan, NBT scan, and double marker, we can rule out some anomalies like trisomies 13, 21, 18, and this test must be taken by every pregnant lady. And because there is a very short window, that is 12 to 13 weeks, this window should not be missed. Second trimester, well-developed hair, eyelids, nails, clear heartbeat audible with the Doppler instrument. In the first trimester, if we want to hear heartbeat, we need ultrasound. But in second trimester, with a very simple instrument, Doppler instrument, baby's heartbeat is audible. And the baby movement felt around 5th month by pregnant lady. And in first pregnancy, usually it comes around 20 to 22 weeks. But in second trimester, in the second pregnancy, as she's already aware how it feels, she might feel baby's movement by 18 weeks. Lenigo, thin hair which covers shoulder and back, and vernix caseosa protects the skin. That also starts showing in second trimester. Baby's ear develop enough to perceive sounds, including the mother's voice and external noises. I would like to talk few words about Garbh Sanskar. Garbh Sanskar, your baby can hear what you are saying, and things, and baby can feel an environment around. And so a pregnant lady must be in the positive environment, and she should feel all negativity so that baby is healthy and it has positive impact on the baby. And it is in theory, so it is very, very important. Even if she is listening to music or a movie, it should have positive impact on a pregnant lady's mind. Third trimester, growth and development of existing organs continue. A layer of fat will begin to be stored by the 7th month. Hearing fully developed at this stage, baby can see kicks more by 8th month. Lungs mature for birth during 9th month. And baby movement reduces as they get position for birth near the birth canal. In third trimester, if we look at pregnant lady's abdomen, we can see kicks of a baby from a distance. But by the end of third trimester, during near term, baby movement reduces because with advancing pregnancy, in the last few weeks, liquor is water bag around baby. Liquor decreases and baby size increases, so baby movement reduces. But a pregnant lady must know how to count fetal movements, and she should have record for that. And if she has less fetal movement, she must inform her doctor. And the best way to count fetal movement is after meals, after breakfast, after lunch, after dinner, for 1 hour. And if movements she should, and in that 1 hour she should feel at least 5 movements. If she is feeling 5 movements in that postprandial hour, it is normal. Must do's for all pregnant mothers, also quite helpful in managing the challenges. Diet and nutrition. Eat small, frequent, bland meals for nausea management. And consider foods with ginger for relief. Choose low-fat food. Avoid triggers, worsening nausea. Increase fiber intake with fruits, kale, and whole grains. And she can avoid constipation if she is taking high fiber diet. Stay hydrated. It is very important. She must drink at least 2 liters of water every day. And she should also add healthy liquids like coconut water every day. Consume green leafy vegetables and avoid highly processed food, avoid sugary food, and avoid junk food. Prenatal yoga and exercise. Exercise is very important, and in normal pregnancy, a lady should do exercise at least for 30 minutes, mild to moderate exercise. But after her doctor's advice, she must consult her doctor before exercise or yoga, because in pregnancy there are some conditions where a lady should not do yoga and exercise, like placenta previa, when placenta is down in the uterus or near the uterus mouth, because there is risk of bleeding. In that case, she should avoid exercise. And where if she has incompetent os. Os is mouth of uterus. If it is weak, or if os is short and dilated, she should avoid exercise because it might result in preterm labor. So these are few conditions where she should avoid exercise and yoga. But in normal pregnancy, where there is no complication, she must do moderate exercise after her doctor's advice. Stretching the right muscle group regularly, build strength in pelvic floor, core muscles, breathing exercise are good. And it will help It will prepare her for normal delivery if she has strong muscles. Consider prenatal yoga for backache relief and better chances of normal delivery. Relaxation and sleep. Practice relaxation techniques like deep breathing, meditation. Prioritize adequate sleep. Aim for 8 hours daily. And sleep at a stretch is always better. And she must take 7 to 8 hours sleep every day. And she should not overexert. She must listen to her body. And she can use a belly band or pregnancy support belt, pregnancy pillow, according to her convenience and comfort. Medical help. Seek medical attention for severe nausea. Mild nausea is very common, and it can be dealt with proper hydration and food, as if she includes ginger and bland foods, low fat foods, and small frequent diet. But if nausea is severe and she is not able to take, even her kidney function might get deranged, she must take help so that it doesn't affect fetus developing baby inside her. What to avoid? Do not smoke or consume alcohol. No amount of alcohol is safe in pregnancy. And smoking, active, passive, she should avoid. She should not sit close to a person who is smoking, because passive smoking is equally harmful. Do not handle cat litter, as it increases the risk of toxoplasmosis. And because of toxoplasmosis, she might have fever, muscle pain, and some defects in the baby. So she must avoid handling cats if they have at their home. Do not consume certain fishes, as they may be high in mercury content. Do not consume undercooked or raw meat and eggs. Fish, undercooked food, and raw meat or highly processed food, they might cause listeriosis, and which is and this infection in pregnant lady, she might feel fever, or she might have loose motion. So she should avoid such kind of foods. Avoid using hot tubs and sauna. Pregnancy is a beautiful journey, and preparation for pregnancy begins before pregnancy. As I told, folic acid supplementation should start 2 months prior to planning pregnancy, so that neural tube defects can be prevented 100%. And in pregnancy, she should have regular follow-ups so that she can take routine tests at time. And she should have proper vaccination during pregnancy. And in pregnancy, 3 vaccine shots are given. One is tetanus toxoid. Second is Boostrix, which is DPT, which protects against 3 diseases, that is diphtheria, pertussis, and tetanus, which is given between 26 to 33 weeks. And third is flu shot. So these 3 vaccine shot should be given to all pregnant ladies. And I will talk a few words about test. In the first visit, we do certain tests in the very first visit, so that if she has any medical issue like diabetes, blood pressure, thyroid, so that treatment is started as early as possible, so that her baby is normal and her medical condition does not affect her pregnancy and developing fetus inside. And in pregnancy, body demands increases. She should have proper diet, proper rest, proper hydration. Along with that, some micronutrient demands cannot be met with normal diet. And folic acid supplement, iron supplements, calcium supplements, vitamin D supplements should be taken after your doctor's advice. And some tests I was talking about in the first trimester, in the very first visit, test as complete blood counts, ABRH grouping, and VDRL viral markers like HIV, HBsAg, anti-HCV, and test for thalassemia, test for rubella. It should be taken, and first ultrasound should be around 6 to 7 weeks, and it helps to calculate uh, gestation and due date of pregnancy. And by the end of first trimester, as I told, 12 to 13 weeks, double marker test and level 1 ultrasound anti-scan and BT scan must be done so that anomalies can be detected at earliest. Second most important ultrasound is level 2 anomaly scan, which is done between 18 to 19 weeks, where detailed anatomy of fetus is done. And because 3 to 4% babies might have anomalies, and on level 2 ultrasound, now in 99.9% cases, these anomalies can be picked up. And one more ultrasound for is fetal echocardiography, which can be done along with level 2 ultrasound at 18 to 19 weeks. And third ultrasound by the end of 7 months, you can say 30 to 32 weeks, routine scan and Doppler study should be done to assess baby's growth, to check that proper blood flow is there. And last ultrasound at term so that her delivery mode of delivery can be planned. So in pregnancy, take care of yourself. You should have regular follow-ups with your doctor so that you have normal pregnancy and a healthy baby. Parul?
Thank you so much, Dr. Ekta. That was so informative. I myself find so many things new. Even after I thought I knew a lot, I'm very sure that every pregnant mother and every parent, I also think that dads are equally responsible. So while you mentioned multiple times that they need to take care, and of course the family needs to take care of the mother, but a lot of this information must be not just shared with the mothers, I feel, but also with the fathers equally, because they are equally involved in the child's birth and be able to take care of the mother better. So thank you so much for such wonderful information. Before I break for Q&A, let me just first ask all of you guys, whoever is live right now watching this video, please go ahead and put any other questions that you have for Dr. Ekta, and we will be picking up some set of questions. We'll try to pick as many as we can with whatever time we will have. But we will try to pick as many questions as possible in the next few minutes. So please go ahead and put that in the live chat window on YouTube. Before I go to the Q&A session, I just want to quickly recognize what all just Dr. Ekta just mentioned about the challenges that a pregnant woman faces, and so many things that she can do to not just manage those challenges, but to ensure that the baby is growing well. She is ensuring that her baby is emotionally and physically developing into a very healthy human being. Not just normal weight, but healthy body developments, mind developments, and all of that depends so much on what we are doing during pregnancy. Like I mentioned earlier, of course, after the delivery as well, how quickly you recover or how easily you recover also depends on how you handle your body during pregnancy equally. So I think considering all of those things itself, we at Tata 1mg tried to help all our mothers to be and created a specific program for pregnancy care to take care of them, to give them the support that they need, all the support that they need, so that they don't have to think about what else can I do, or what should I do, or where do I go for this and that. They just join a single program and give your mind away and just follow along with the program, make sure that not just the baby's development is happening well, but you are facing lesser and lesser challenges in the pregnancy. So happy that we could do it bang on. As just Dr. Ekta mentioned, all the things that are important mentioned during her presentation. I'm so happy to see that we have everything listed down here, right? For the pregnancy program, anybody who's interested to join pregnancy program, any expecting mother will get a complete care, including live yoga workshops, which are given by trained prenatal online yoga instructors. It's a complete online program, but the instructors are highly trained in giving online yoga. The session has very, very limited batch size so that the instructor is able to give focus on each and every participant in the program at the moment. So these live yoga workshops, especially curated for prenatal yoga, will be very, very helpful for all of you. Diet counseling, I think Dr. Ekta just mentioned that diet and nutrition is one of the most important things that you need to take care throughout your pregnancy. You have to make sure that you eat well so that your baby's development is well, because your baby is really what you eat. So what you eat, in what frequent intervals, how much water, how much of fiber, how much of micronutrients, as you mentioned, all of that will be taken care by the special diet counselors who are trained in prenatal diet counseling. Of course, you will have a personal buddy who is going to help you throughout all the services. You will have a community support of moms and moms-to-be, where you can join and share your emotional stresses, know what's going on with other mothers, and try to help them while they try to help you. We also have a specific service which is called Trusted Answers with Quick Chat, which means that, of course, like right now, you will be able to, I see that there are so many questions that all of you guys have. But of course, you will keep having these questions throughout the pregnancy, right? So whether it's first trimester, second or third, your questions will never go. You will have new questions every day, whether it is normal, can I do this, can I do that? And all these simple questions, sometimes you're not really able to ask your gynecologist right away. Either they don't have time at the moment when you read answer, or you are hesitant because you're asking too many questions, you feel. So for all of those ladies, we have Trusted Answers, where you can just put a question in a chat box, and we will be able to get you connected with a senior gynecologist to help you with those answers right away. Any basic question you have, you will not have to bother going to Google and figuring out whether that answer is right or not. You will have an answer from a gynecologist. So all of these services as a part of just one simple program. If you are interested, do make sure that you sign up to this program. And you can sign up using the link that we are sharing in the chat window right now. The link to sign up, the QR code, the WhatsApp number that you can connect to actually show interest and sign up are all there, going to be at the end of this presentation, in your chat window, and in the group description of this video. So go ahead, sign up, ask any questions that you have, clear all your doubts, and of course, do sign up after that. But I highly recommend that you do that so that all of these queries just go away and you have a safe and healthy pregnancy. Now, before I further ado, let me take a few questions and ask Dr. Ekta. A lot of questions have come in, and I'm going to try and see what all we can cover. But here we go. Ma'am, one of our users wants to know that, I think it's in Hindi, so I'm going to take it in Hindi exactly as it's mentioned. Ma'am, मेरा 1 year पहले 6 week में miscarriage हो गया था, but अभी मैं 6.5 week pregnant हूँ. And डॉक्टर ने मुझे इकोस्प्रिन प्रिस्क्राइब किया, पर उसको लेने से मुझे 24 hours sleepy and senseless feel होता है.
Yeah, Parul?
Yeah, so that's the question, ma'am. Is that normal? Yeah. Is it okay to continue taking the medicine? Is it okay to feel sleepy and senseless after taking icosprin?
Yeah, as she said, she had one missed abortion at 6 weeks, and now she is 6 weeks, 5 days, and her doctor prescribed her Ecosprin. Right dose of Ecosprin is 150 milligram, and it should be taken at bedtime. And sleepiness could be due to pregnancy changes, due to effect of hormone changes like increased level of progesterone. It could be due to ecosprin as well. So it is okay to feel more sleepy at this time. And one more thing, in first trimester, most of the time, you can say 75% of miscarriages, they occur in first trimester. And most of the miscarriages are due to some genetic defect or due to genetic reason. But some of the miscarriages, they are due to microclotting. And there are two drugs, ecosprin, as she is already taking. It really helps to prevent microclots. In turn, it prevents missed abortion. And there is one more drug which is called heparin, low molecular weight heparin. But disadvantage of that is it comes in injection form. It is expensive, but again, it is very helpful to prevent missed abortion. So she is on the right track. She is taking ecosprin, and she must continue so that risk of probability of miscarriage can be minimized.
That's so good to know. I hope you got your answer, audio user, and all the best for your pregnancy. Second question, ma'am. Another user has asked, मुझे 6 months start हो गया है, and there are slight problems in breathing sometimes. Like there are थोड़ी सांस फूलने लगता है या normal होता है. तो किसी को ऐसे symptoms होते हैं pregnancy में, और ये मेरी first pregnancy है, तो of course she is highly anxious.
Yeah, in my presentation, I told there it is normal to have breathlessness, but it should be mild breathlessness only, and she should not have breathlessness all the time, even at rest. It is not good, and to have relief from breathlessness during sleep, she should take 2 pillows so that she should be in basically propped up position. And she should take proper hydration and small frequent meals. And before going to bed, she should walk, and she must take her dinner 3 hours before going to bed so that she gets time to digest it. And but if breathlessness is very severe, we might need to rule out respiratory cause or cardiac causes. But little bit of breathlessness, it is normal, and she can even practice yoga for that. She can practice deep breathing for that.
Oh, that's great. At least there is something that could help. So I think that's coming from Weber. Please go ahead and first figure out whether you are not, you or your wife are facing severe breathlessness, or is it something that's manageable? And if it is something that's not very severe, then do try out prenatal yoga and breathing exercises. As Dr. Akta mentioned, that should definitely help you. Okay, ma'am, the next one is, can you please explain about spotting or bleeding during first trimester? And at which situation do one needs to see a doctor?
See, in first trimester, many pregnant ladies experience spotting or slight bleeding. This is also called implantation bleeding. But we need to keep a check whether fetus is growing properly, and we can do that by doing ultrasound. Spotting could be normal, but if bleeding is heavy, it is not good. Even if she has spotting, she must consult her doctor, because at times brownish color discharge, at times it is normal, but at times it is sign of missed abortion. So we have to keep a check. She must consult her doctor.
Sure, thank you so much, doctor.
And one more thing, at times when she has spotting, there is bleeding inside, there is clot inside the uterus, so which we can detect on ultrasound, and we can start medication at time so that she continue with healthy pregnancy.
Okay, great.
Yeah.
So Nikita, that's from you. Please go ahead and consult with a gynecologist first. Get her consent on what needs to be done, and as Dr. Akta mentioned, an ultrasound could be something that could help in detecting what's really happening inside. And we really hope that it's all good. Okay, there are a couple of questions which I'm not really going to bother Dr. Ekta meanwhile, because I think that's something that is clearly mentioned. Can you explain the normal range of liquor? She's mentioned there is no normal range of liquor. You must not consume any amount of alcohol during pregnancy. So I think there we have. Please avoid. Some of the questions are around knowing ovulation dates and such. Ma'am, people want to know if they are trying for pregnancy, how can they understand when should they really try and when should they conceive?
Yeah, Parul, ovulation, if a lady has regular menstruation, means she has fixed cycle, maybe 28 days, maybe 30 days or 35 days, because cycle between 24 to 35 days we consider normal. If she has normal cycle, then she can calculate her fertile period, her time of ovulation, and it is usually 14 days prior to beginning of menses. So if she has cycle of 28 days, her period comes after 20 days, so she 14th day is very fertile, but window of 6 days, you can say from 11th to 17th day, it is very, very fertile. And there are some changes in body going on during ovulation. Like her body temperature is slightly raised, maybe 0.5 degrees. She might feel thick, stretchy discharge during ovulation. And nowadays, she might feel pain, which is called Mittelschimmer's pain. This is pain of ovulation because there is mild free fluid in the abdominal cavity, and because of which she might feel abdominal pain. So these are the signs which indicate ovulation is happening. And to confirm, she can also use ovulation kits, which are easily available in the market, and she can find that.
I think that's very informative. I'm sure there are a lot of apps that help you, but I think just a general range of date, if you are able to keep a date of, that should help you understanding whether you're in ovulation cycle or not. Ma'am, since you've touched upon not handling cats litter and managing cats during pregnancy, I think we have a few questions around having different other kinds of pets at home, dogs and such.
Yeah, especially cat litter. As I told, cat feces. This could cause toxoplasmosis, and due to toxoplasmosis, baby can have harmful effects, even effects on eyes and brain. It can happen. So she must avoid handling cats. A disease called toxoplasmosis, and she must avoid.
But handling
people have fever, muscle pain, and effect on baby. As I already told, maybe at birth baby will be normal, but baby might develop these problems later on.
Sure. So I think it's kind of still safe to be able to handle other pets such as dogs if you have at home. But of course, hygiene is something that you have to be very careful about. Great. There are some specific questions as well. I have done my double marker test in 12 weeks, 4 days. My beta HCG level is 13.6. Statistically, the result of double marker test is negative. How will it affect my baby?
Parul, can you please repeat the question?
Sure, ma'am. I have done my double marker test in 12 weeks, 4 days. My beta HCG level is 13.6. Statistically, the result of double marker test is negative. How will it affect my baby?
See, if double marker shows screen negative for trisomy 13, 18, and 21, it means there is a probability of having babies affected with these three trisomies, 13, 18, and 21 is very, very less. And there are, apart from these values, there are many factors which affect result of the test, because there are many other factors which are also considered, like age of expecting mother, that also needs to be included in that. Because if mother's age is 35, automatically risk of having trisomy increases. So the result automatically changes. But if you have a graph showing these three trisomies screen negative, that is 13, 18, 21, it means probability of having these trisomy is very less.
You have your answer there. Ma'am, there are a few questions. Of course, there are so many questions around what not to eat and what to eat, because everybody kind of suggests different things. So there are questions on whether can we eat papaya, whether can we eat mushrooms, pineapples.
Parul, papaya, especially raw papaya, raw pineapple, it should be avoided during pregnancy. And there are certain other foods as well, like caffeine. Too much of caffeine is not good. If a pregnant lady is a coffee drinker, she should not take more than 1 cup of coffee every day. Tea, she can have maybe 2 or 3 cups, because caffeine quantity is very less in tea as compared to coffee. And food which has a Ajinomoto, like Chinese food, she should avoid that because it might cause IUGR. So she should avoid all these foods. And alcohol, as I already told, no amount of liquor is safe. So she should not take that. No amount is safe because it affects baby's brain, baby's IQ. So she should not take that. So these are certain foods which she should avoid, and other food like highly processed food and like meat, fish, which can cause listeriosis. She must avoid, and junk foods, sugary food. These are the foods which should not be taken during pregnancy. If she has craving, she can have little bit, but she should try to avoid.
I was about to mention that, of course, if you have food cravings, you might want to
Yeah.
but don't eat too much and try to portion control what you're eating, and of course the frequency of what you're eating.
Because weight gain should be okay in pregnancy, because if it is about 15 kg, 20 kgs, it will invite pregnancy complication, gestational diabetes, pregnancy induced hypertension. And if a lady is obese, it decreases chances of normal delivery as well. So she should check on her weight gain. 10 to 12 kg weight gain during 9-month pregnancy is optimum.
Yeah. So basically, whenever you going for gynecologist visits, you would anyways be getting your weight checked.
Yes.
Keep a check on that. And while there are a lot of not to eats, there are a lot of to eats foods. So please try and focus on all those should be eaten foods, all the natural foods, all the foods which are high in fiber, and all the foods that we were just mentioning in the presentation. I think there are those foods that are going to be responsible for how healthy your weight gain is going to be and how healthy your baby's weight is going to be.
Parul, if you allow me, I would like to talk about GTM, because I want to give message to my pregnant ladies over there.
Oh, ma'am.
Yeah, gestational diabetes nowadays, it is very common, and you can say incidence is about 1 in 10. 10% of pregnant ladies develop gestational diabetes mellitus, and it usually comes in third trimester, you can say 7 month, 30 weeks, or after that. And for gestational diabetes mellitus, there is a test called GCT, glucose challenge test. This is for universal screening, and every pregnant lady should take this test, and very sensitive and specific test, because as I already told, incidence of GTM is increasing in India, and GTM is very well controlled if diagnosed at time. And earlier we used to give insulin injections to pregnant ladies, but now drug called metformin, which can be taken orally, it is very safe and it very well controls gestational diabetes. And just for gestational diabetes, again, weight gain should not be too much. There should be average weight gain only, and she must avoid sugary. And ladies who have family history where her parents are diabetic, she has even more chances of developing gestational diabetes. And again, thyroid in our population, it is increasing day by day. Especially hypothyroidism is very common. Again, incidence is very high. And thyroid also directly affect growth of baby. So thyroid medicine, it should be started well in time, so that it doesn't give negative impact on baby's health. So that's all, Parul. It just came to my mind, and I wanted to share it.
I think it was a very important topic. I think you covered, ma'am, because as you mentioned, it is such a common occurrence these days that one has to be very careful about developing GCT. Okay, I'll just move on to a few more questions, ma'am. I think the last
yes, please.
To close. Is loose motions, because we just mentioned that constipation is normal, is loose motion also normal in second trimester? And I think the context that this person, Mr. Prashant, wants to give is that his wife is having twins, and he also wants to understand where pantoprazole is safe in pregnancy, because I think they're using that. Oh, there are too many doubts about the medicines that
see, constipation is normal in pregnancy because it is due to high level of progesterone, because gastric emptying is slowed, and you can say movement of intestine is slowed under the effect of progesterone. So having constipation in pregnancy is normal. And constipation is due to constipation, she might develop piles as well. But loose motion is not normal in pregnancy. Loose motion means she has some infection in her gut. And if it is mild, it can be treated first with the food. Basically, she should take binders like yogurt, dahi, and khichdi and banana. And she should stop iron for a while when she is having loose motion, and milk, because it might aggravate the problem. But if it is not treated just by altering diet, she must need medication, and there are safe medications for loose motions in pregnancy. And one more thing, pantoprazole, rabiprazole, these are safe. And again, these medicines are given for acidity, heartburn. First, she should try with altering food habits, like she should take low fat food, and oily foods, fried foods should be avoided, spicy food should be avoided, and she should take small frequent meals. So it will help her to avoid acidity, and plus exercise that also help in controlling acidity. But still, if it is not controlled, she can take medications. Again, she should start first with simple medications like antacid syrups. Many syrups are available in the market: Gelusil, Diagen, Aljalase, so many. And if it is not controlled with that, she can of course take pantoprazole tablet or tablet rabiprazole. It is safe, but medication should be taken when required and in the minimum possible dose, and after consulting your doctor. Please do not self medicate yourself in pregnancy, because all medicines are not safe in pregnancy. So we have to take baby's health in mind before giving any medication to a pregnant lady.
Ma'am, one more question. Is it okay to go for casual swimming sessions during pregnancy?
See, as I told, in pregnancy, moderate exercise like walking, yoga, even swimming, it is safe. But again, after consulting her doctor, and if she has some conditions, like if she has spotting, bleeding, incompetent hours, her placenta is low lying, or she has lower abdomen pain, she should avoid. In that case, if it is normal pregnancy, no complication, after her doctor advice, she can go for swimming session, no problem.
This is a very interesting question, which I want to definitely take. Which should be preferred, normal or C-section delivery? I would love to get an answer.
This is the most controversial answer. Most controversial question, Anyway, see, any natural process is very good. And normal delivery is definitely good if there is no indication for cesarean section. But there are certain indications where normal delivery cannot be planned, like placenta previa, where placenta is covering the os, because the moment she has pains, she will have bleeding, and it will affect baby. And certain other conditions, if she has transverse lie, baby's position is not normal. Normal position is baby's head is down. If she has breech, breech presentation, or baby is in transverse position, where there is in transverse position, there is no mechanism for normal delivery, then she has to go for cesarean section. But otherwise, normal delivery, because it doesn't give scar to your uterus, and if you have first normal delivery, your second normal delivery become much easier. So, but for normal delivery, she has to prepare herself throughout. Her muscles, her willpower should be strong. She should be okay to have pain. She has to prepare herself physically, mentally, emotionally.
Yeah. So I think rounding it back, you definitely need to do this moderate to light exercise if you are allowed. You need to do breathing exercises. If, I think that's something that all of you guys should be able to do. So exercise, I think, just to kind of put it all together and conclude it in a way, because there are a few more questions and I'm really not able to take them. But most important thing that we are all listening to is definitely eat some of the things and definitely do not eat some of the things. Do make sure that you are taking some amount of moderate to light exercise regularly. And of course, do not take any medication by yourself. Ask gynecologists, ask your doctors. Try to trust them more. And I think with all of these things, I'm quite surprised that there's so many of these questions. And I would really urge all of you guys to definitely consider joining this program that I just talked about a few minutes back, because it will give you answers to almost all of the questions you guys have, and we'll be able to serve almost all the needs that you guys have just told, whether it is yoga, whether it is diet related questions that you have, whether it is those simple questions about swimming classes, or whether can I do this or not, or anything about your basic medication. I think all of those things will be taken care of if you consider joining this program. Do take a look. It is something which is very affordable. At least express interest. There are special discounts, by the way, that are running just for next 24 hours. Specifically for this event, because we really wanted to celebrate. It's the first of this event, and with so much interesting insights from Dr. Ekta coming in, we really want to celebrate this event, and that is why there are special discounts only for the next 24 hours. If you're interested, go to your chat section, click on the link or your group description, and click on the link to express interest. You can also WhatsApp the number that's provided, and if otherwise, also if you have any other questions, please feel free to just ping on the WhatsApp number, and we'll try to be as helpful as possible for all of you guys, because this is what we are really working hard towards. We really want to help you all. Thank you so much, everyone, for coming, and special thanks to Dr. Ekta for taking out time. She's been traveling. She just landed a few hours ago, I think a few minutes ago before the session, from some other important meeting, but she still made some time out for all of us, and helped us with all our insights and so many questions that all of us have had. So thank you so much, Dr. Ekta, for such a lovely session.
Thank you, Parul, for arranging this webinar and giving me opportunity. It always gives me pleasure to talk to my patients, especially pregnant ladies. I feel happy I feel glad if I can help them in any way. So it's altogether my pleasure. I got this chance to talk to pregnant ladies and audience. Thank you so much for patient listening, everyone. Thank you so much.
Thank you. With the last quote, I would want to end this, and I think all of us would kind of believe in it. As I call it, pregnancy is a journey which is about a birth, of course, of a baby, and a rebirth, which is of the mother there. So take care of yourself, take care of your baby, and if you have any questions, do drop in on the WhatsApp number, and feel free to ask for support and help. That's all. Thank you so much, everyone. We're closing this chat now. Thank you, Dr. Ekta, again.
Thank you, everyone. Thank you, Parul. Goodbye. Bye.